Good morning, everyone, and welcome to today's presentation. I'm Dr. S.K. Singh, and I'm pleased to have the opportunity to discuss an important aspect of sterility testing. Today's focus is on the sterility testing direct transfer inoculation method. In this session, we will explore the principles, procedures, and significance of this method in ensuring pharmaceutical safety. I look forward to sharing useful insights with you all. Let's get started. Let's begin with the introduction to sterility testing. This process is all about making sure that a product is free from any viable microorganisms, which is crucial for patient safety. Now, one of the traditional methods we use is called direct transfer. This is considered a classical sterility testing method and has been relied upon for many years. It's particularly useful in situations where membrane filtration isn't suitable, perhaps due to the nature of the product or other factors. The importance of this method is recognized internationally, and you'll find it widely accepted in major pharmacopoeias like the United States Pharmacopoeia and the European Pharmacopoeia. Overall, sterility testing, including methods like direct transfer, plays a vital role in ensuring the safety and quality of pharmaceutical products. On this slide, we're focusing on the core principles of sterility testing. Essentially, we take a test sample and directly inoculate it into culture media. If microorganisms are present, they will grow in this media, making it easier for us to detect contamination. Typically, we look for signs of growth such as turbidity or visible colonies, which indicate the presence of microorganisms. Moving on to the regulatory basis, sterility testing is governed by established standards like USP 71 and pH. UR 261. These guidelines ensure consistency and reliability across different laboratories. The World Health Organization also provides important guidelines in this area. To ensure accurate results, certain requirements must always be met. These include maintaining aseptic conditions to prevent contamination, operating within a controlled environment, and using a validated test method. All these elements work together to uphold the integrity of the sterility testing process, which is vital for ensuring the safety and quality of pharmaceutical products. Let's walk through the procedure overview. First, it's crucial to prepare sterile media to prevent any contamination. Next, you transfer the sample directly into the media, making sure not to introduce any outside microbes. Proper mixing is essential to distribute the sample evenly throughout the media. After that, incubate the cultures under the specific conditions recommended for the media type, which usually involve the right temperature and atmosphere. Finally, observe the cultures closely for any signs of microbial growth, which indicates the presence of bacteria or fungi. Now, regarding the media used, we have fluid thioglycolate medium, or FTM. This medium is particularly versatile because it supports both anaerobic and aerobic bacteria, making it ideal for detecting a wide range of microorganisms. Then there's the soybean casein digest medium, or SCDM, which is great for supporting fungi and aerobic bacteria. Choosing the right media is key to accurately identifying the types of microbes present in your sample, and that ties directly into the overall goal of our testing process, ensuring reliable and comprehensive microbial detection. Let's go through the interpretation of our results. When the media appears clear, we consider that a pass, which indicates the sample is sterile. On the other hand, if we observe turbidity, that's a fail, meaning the sample is contaminated. To confirm these findings, we perform additional tests like subculturing and identification tests. These steps help us verify whether contamination is present and identify the specific microorganisms involved. Now, the detailed procedure involves aseptically adding the sample into two different media. First, we inoculate into FTM, or fluid thioglycolate medium, and incubate it at 30 to 35 degrees Celsius. Then, we transfer the sample into SCDM, or soybean casein digest medium, and incubate that at 20 to 25 degrees Celsius. We keep these cultures incubated for a total of 14 days, and during this period, we perform periodic observations. Monitoring these cultures regularly allows us to detect any microbial growth early and ensure the accuracy of our sterility testing. This process is critical because it helps us confirm the initial visual assessment and ensures the reliability of our results in maintaining product safety and quality. Now, let's take a look at some of the key applications where these testing methods are essential. First, we have oily preparations, such as injections that are formulated in oil. These require specific attention because the oil base can affect how we perform sterility testing. Next, we have creams and ointments, which are topical formulations that need to be sterile to ensure safety and efficacy. Suspensions are also included. They are liquid preparations with solid particles dispersed throughout, and maintaining sterility here is crucial to prevent contamination. Lastly, we have medical devices that are non-filterable, meaning they can't be sterilized through filtration, so alternative testing methods are necessary. To give you an example, consider the sterility testing of an oily injection. Instead of dissolving or diluting the product, we directly inoculate the oil-based drug into the culture media. We then incubate this setup for about 14 days. If after this period, there's no turbidity or cloudiness in the media, we can conclude that the product is sterile. This approach highlights how we adapt our testing techniques to different formulations to ensure product safety across various applications. Now, let's take a look at some additional challenges we might encounter. One of these is interference by preservatives, which can sometimes make it harder to accurately detect microbial growth. Poor mixing of the sample with the media is another issue. If the sample isn't evenly distributed, it can lead to inconsistent results. High viscosity in samples can also affect microbial growth, making it more difficult to get reliable outcomes. Because of these factors, strict aseptic handling is essential to prevent contamination and ensure accurate results. Moving on to the advantages and challenges of this method, one big plus is that it's simple and cost-effective. It's also suitable for products that can't be filtered easily, so it has practical applications across different types of samples. Plus, you don't need complex filtration setups, which keeps things straightforward. However, there are some challenges to keep in mind. For example, products can sometimes inhibit microbial growth, making it harder to detect contamination. Detecting low-level contamination can also be tricky. Sometimes it slips under the radar. The method usually requires limited sample volumes, which can be a constraint, and there's always a risk of false negatives, meaning contamination might go unnoticed. Understanding these pros and cons helps us choose the right approach for our specific needs and ensures we interpret results correctly within the broader context of quality control. Let's talk about method validation. When we're validating a method, it's crucial to perform a method suitability test. This test helps us ensure that the method is appropriate for its intended purpose. Specifically, it demonstrates two key things. First, microbial recovery, which means the method's ability to accurately detect and measure microorganisms present in the sample. Second, it confirms the neutralization of inhibitory substances, ensuring that any substances that might interfere with the detection are effectively neutralized. Additionally, the suitability test includes growth promotion testing. This step verifies that the medium and conditions support the growth of the microorganisms we're trying to detect, which is essential for reliable results. Overall, these steps are vital because they ensure that our testing method is both accurate and reliable, which ties directly into the overall goal of maintaining quality and safety in our processes. So, in conclusion, let's emphasize that direct transfer remains an essential alternative method in our toolkit. It's particularly useful when dealing with products that can't be easily filtered or processed through traditional means. However, it's important to recognize that this approach comes with challenges, and those challenges require us to validate our processes carefully. Ensuring that these methods are thoroughly validated is critical, especially when it comes to maintaining regulatory compliance and, most importantly, safeguarding product safety. Throughout this presentation, we've seen how choosing the right transfer method is key to meeting both regulatory standards and quality expectations. For further support, please feel free to contact us. We're here to help you with any questions or additional information you might need. Remember, this presentation is just the beginning, and we're committed to assisting you every step of the way. Thank you so much for your time and attention today. We appreciate your interest and look forward to connecting with you further.